Hello everyone. Thank you for joining me today. My name is Brendan Perozzo, and I'm a kinesiologist that works with the Rural Wellington Low Back Pain Program. In the next 10 minutes, I'll be sharing some practical tips and tricks to help you manage and alleviate your back pain. Back pain is a common issue that affects many of us at some point in our lives. Whether it's due to everyday activities, injuries, or even poor posture, understanding how to manage and prevent back pain can be a significant difference in your overall quality of life. I hope you find this information useful and that it provides you with some actionable steps to help you manage and reduce your back pain. Let's dive right in. If you're watching this presentation, you likely understand how back pain can significantly impact your daily activities and change the course of your day. The goal of this presentation is to provide you with practical tools to use when your back pain becomes bothersome. On this slide, you'll see common activities circled that often cause back pain in day-to-day life. Take a moment and see if you can relate to any of them. Listed below are a wide variety of activities, from sleeping to household chores, and it is very important to note that back pain can be different for everybody, and activities that are okay for some people may be extremely irritating to others. On the slide below, there are strategies we can adopt in our daily life to help prevent our back pain from being aggravated when doing tasks. We call these maintenance strategies. Maintenance strategies are things we can do on a daily or weekly basis to keep our back feeling good. The ones discussed in this presentation are just a few of the strategies used for managing back pain. Some of the topics we are going to discuss today are exercise. Exercise is important because it strengthens our muscles that support our spine and can improve our flexibility. Breathing. Diaphragmatic breathing can enhance our core stability and has the ability to reduce our pain. Lifting technique. Proper lifting techniques can and will prevent strain on our back. And managing demands. These are techniques to increase our back capacity while reducing the demands we put on our back. It is beneficial to develop a back pain plan or toolkit with strategies that have worked for you to better manage your back pain. Today, we're going to start by diving in to the muscles that effectively support our backs so we have a better idea of how to better build our management toolkit. Understanding the muscles that support our back can help us better manage and prevent lower back pain. Let's take a quick look at 4 key muscle groups: the abdominals, the diaphragm, the pelvic floor, and the multifidus. Firstly, abdominal muscles. These muscles play a crucial role in supporting our spine and maintaining proper posture. They act like a corset and provide stability to our trunk and reduce strain on our back. Strengthening our core, which includes abdominal muscles, can significantly help in managing lower back pain. The next key muscle group would be the diaphragm. This dome-shaped muscle is located just below your lungs and plays a key role in breathing. The diaphragm also contributes to core stability by working in coordination with the abdominal muscles and the pelvic floor muscles during respiration. Proper breathing techniques can enhance this support, reducing back strain. Moving toward the pelvic floor at the bottom of the picture here, these muscles form the base of the core, and they support the organs in the pelvis. They also work with the abdominal and back muscles to stabilize the spine. Weak pelvic floor muscles can lead to poor posture and back pain, so it is very important to keep them strong and functional. Lastly is the multifidus muscles. These are small but very powerful muscles that run along the spine and provide crucial support in each vertebrae. They help maintain spinal stability and control movements. Strengthening multifidus muscles can improve spinal alignment and reduce the risk of back pain. Understanding and focusing on these muscle groups during exercise, you can improve posture and enhance stability and reduce lower back pain. Incorporating exercises that target these muscles into your routine can be very, very beneficial in maintaining a healthy back. With a significant amount of back pain, there's often an imbalance between resources and demands. Your back can only handle so much. For example, we often see that high demands required from our bodies to clean the entire house in a day exceed what our back can handle, which often results in a flare-up. Our goal is to work with you and to support you in identifying the causes of this imbalance and discover what changes you can implement in your daily life to help you find a better balance for you and your back. A lot of this stems from listening to our backs and not overdoing it. So instead of pushing through the pain to clean the house an entire day, we need to learn to listen to our backs like its warning signs and modify and stop activities when the demands are exceeding our capacity. The focus of our Rural Wellington Low Back Pain Program is not to completely eliminate your pain, but to give you the tools and strategies to help you reduce the level of pain and discomfort you're experiencing. The image demonstrates how working to increase your back capacity and decreasing your demands can be an effective means to reduce lower back pain. In this program, we work with you to educate about healthy lifestyle choices that impact your back health, to increase the capacity on the green left side, and ways to modify how you are doing tasks currently to reduce demands on the right side. To manage back pain effectively, we have to get this teeter-totter balanced as possible. Unfortunately, we do not always get it exactly balanced, and it does vary day to day or even month to month since our lives are changing, and so is our capacity and demands. Now let's explore some of the key benefits of incorporating exercise into our back pain management toolbox. Improved mobility and strength. Regular exercise plays a crucial role in enhancing both mobility and strength. By engaging in different activities, we improve our flexibility and strength of the core muscles that support your back that we outlined earlier, helping to alleviate pain and prevent future issues. Secondly, exercise enhances mood. Exercise is known for its positive impact of mood. Physical activity triggers the release of endorphins, which are natural mood lifters. These can help reduce feelings of stress and anxiety, which are often linked to chronic pain. Thirdly, exercise is great for our general health. Beyond back pain, regular exercise contributes to overall health. It supports cardiovascular health, aids in weight management, and boosts our immune system, creating a stronger, more resilient body. In summary, exercise not only targets back pain directly, but it also improves our overall well-being, making it a vital component of a comprehensive toolbox plan or management strategy. It is important to remember that each individual's experience with back pain is very unique, and what works for one person may not work for another. If you're interested in a personalized exercise or recommendations tailored to your specific needs or back pain, don't hesitate to reach out to our team. We're here to help you find the most effective solutions for your back pain. Now I'm going to discuss posture correction in 3 very common positions: standing, sleeping, and sitting. Firstly, standing. It is important to distribute our weight evenly by shifting our weight between both of our feet evenly and avoid locking out our knees, which would reduce strain on our back. Secondly, maintaining proper alignment, like the picture to the right, keeping our shoulders back, head aligned with our spine, and engaging our core muscles is fundamental in keeping proper alignment. Thirdly, using anti-fatigue mats. If standing for long periods of time, such as at work or at home in the kitchen, it is important to use mats to reduce pressure on both your back and your feet. Secondly, I'm going to talk about sleep. Sleep position, we need to aim for sleeping on our back or side with a pillow between our knees to maintain proper spinal alignment. On the picture on the left, the man at the top has a pillow between his knees and his ankles if he's sleeping on the side, and the man at the bottom is laying on his back and has his pillow but right below his knees. Secondly, it should be emphasized that we need to avoid sleeping on our stomach. This position puts an increased amount of strain on our neck and lower back, which can lead to further discomfort. Thirdly, sitting. It is important to use ergonomic furniture. Choose a chair with good lumbar support and make it adjustable so your feet are flat on the floor and your knees are at hip level. It is important to maintain a neutral spine sitting all the way back in our chair with our legs straight and our shoulders nice and relaxed. Additionally, it's important to take regular breaks, stand up, stretch, move around every 30 to 60 minutes to avoid prolonged static posture. Standing for long periods of time can put a lot of strain on our lower back and make it difficult to maintain good posture. Many people experience discomfort during everyday tasks that require extended standing, such as doing the dishes, preparing dinner, folding laundry, or even talking to a neighbor. One effective strategy to alleviate this discomfort is to elevate one foot. Here's how we do it. Step 1 would be to find a stable surface like a stool or a step. Place one foot on the elevated surface while continuing your task. Alternate your feet periodically to keep your posture balanced and avoid muscle fatigue. The benefits of using this strategy is that elevating one foot helps redistribute your weight more evenly and reduces the pressure on your back. It also encourages a more neutral spine position, which can prevent or reduce pain. Now we are going to discuss breathing. Many people unconsciously hold their breath during tasks, especially when experiencing pain or exercising. Holding your breath is a common response when bracing for pain. For example, you might notice yourself holding your breath when standing up from a chair or during other movements that you expect to be painful. Holding our breath can interfere with proper core function and increase discomfort. As discussed earlier, our diaphragm, which helps us breathe, is very connected to our core that supports our lower back. Breathing while moving will help our core work more effectively and reduce strain on our lower back. Breathing techniques. So, it is important to focus on breathing naturally and consistently through our movements gently. Tips to improve breathing. It is important to be aware of movements when you're holding your breath, and before performing a movement that you expect to be painful, remind yourself to breathe through it. Pair it with thoughts like, "This might hurt," with, "I will breathe through it." It is important to practice and be aware of this. Just start by noticing and correcting holding your breath during daily activities that you expect to be painful. And you can gradually incorporate this gentle breathing technique through our movements into our movements. Now I'm going to go over a quick exercise called diaphragmatic breathing. Remember, the diaphragm is the muscle group at the top, right below our lungs that we discussed in the third slide. So let's try something. Can everybody try putting one hand on their chest and one just below their belly button and take a few deep breaths for me? Take a few seconds. Great. Now tell me, which of your hands move the most? A lot of adults, typically with the exception of singers and maybe public speakers, breathe through their chest, which causes minimal movement in our diaphragm muscle, the important muscle we discussed earlier. Our diaphragm and these deep breaths are actually quite important for proper body health. It helps regulate that internal pressure in your core area. When the diaphragm is moving well, it means our pressure is moving in a flowed manner, which can actually cause better movement in our intestines, which means better bowel movements. Also, if we breathe with our belly, it moves in more of a 360 movement with our trunk area. Belly out in front, ribs out to the side, and we also breathe into our back slightly. This is gentle, yet consistent movement for these areas, which help keep the structures moving smoothly. Again, I would like you to place two hands, and this time, I want you to focus about breathing into your belly, the hand closer to your belly button. We want your chest hand to barely move, but your stomach hand to move lots. Give it a try before the next slide. Next, we're going to talk about lifting principles, largely to prevent injury. I can't tell you how many times somebody comes into my office, I ask what happened with regards to the lower back, and they were lifting an object, likely very improperly. So now I'm going to go over preparation, positioning, and posture. So for preparation, it's important to get close to the object as possible and move any other obstacles that may be in the way out of the way. It's important to position and face the object directly and reposition our body directly in front of it for the lift. We need to maintain proper posture throughout the lift. This looks like keeping our spine neutral and our head aligned. So if we look in the blue photo on the bottom left of the slide, we see that the man has a nice straight back with that white line right behind his back. And then above him, we have the wrong way to lift. So you see the white line in his back very curved. That puts an increased pressure on your spine and back muscles. So it's important to bend at our hips and knees, not our back. Squatting down and letting our legs do the work. We need to activate our stomach muscles to protect our back while lifting the object and maintaining a wide base of support, shoulder width apart. It is also important to stagger our feet slightly, which will help us engage our core. When handling our object, it's important to hold it close, what we call our power zone. And it is important to use smooth and natural movements and reposition our feet when we're moving and avoid twisting at our hips while the object is in hand. 2 important tips I like to go over when teaching people how to lift objects is test the object before lifting. Check the weight of the object and ask for help if it's too heavy. If it's too heavy, I'm sure somebody won't mind lifting it for you at a later time. And important, like the last 2 slides discussed, breathing. We need to ensure we're breathing throughout the lift and throughout holding this object, and we cannot hold our breath. It puts us at an increased risk to strain our back. An alternative lifting strategy is a golfer's reach, which is perfect for picking up small, lightweight objects. In order to use this lifting technique, get close to the object, keep your legs straight and do not bend your knees. Let one leg come off of the floor behind you while you reach forward with one arm to pick up the object. Your chest will be pointed down towards the floor and your lifted leg will act as a counterbalance to your upper body. If you have balance concerns, you can use a free hand to hold a stationary or sturdy object for support. For example, this could be a table or a back of a stable chair. This technique helps avoid back injury, as lifting the back legs allow that spine to stay neutral, just like in the picture in the previous slide. The golfer's reach is not designed to be used for heavy objects, as it is hard to counterbalance and increases your risk of falling. The next thing I want to briefly touch on is how diets can play a role in managing lower back pain. There are 2 main aspects to focus on, which are anti-inflammatory foods and proper hydration. First, incorporating anti-inflammatory foods into your diet can help reduce inflammation in your body, which may alleviate pain. Some examples of anti-inflammatory foods include fruit and vegetables, fatty fish such as salmon or mackerel, nuts and seeds like walnuts and flax seeds. These foods are all rich in nutrients that help decrease inflammation and support overall health. Secondly, hydration. Staying well hydrated is crucial for maintaining the elasticity of soft tissue and the fluidity within the joints. Aim to drink about at least 8 cups of water a day, and more if you're physically active or in a hot climate. Proper hydration supports overall spinal health and function, helping to keep your lower back in good condition. Incorporating dietary strategies into your daily routine can make a significant difference in managing lower back pain. Remember, a balanced diet rich in anti-inflammatory foods and staying hydrated is a key component to supporting your spine and reducing possible discomfort. For some people, medications can be a large part of managing their back pain. There are various options available that suit different needs and levels of back pain. Some individuals rely on prescribed medications to manage their pain, while others find that over-the-counter options like Tylenol or Advil provide sufficient pain relief. It is important to take medications exactly as prescribed by your healthcare provider. If you have any questions about pain management or the medications you're currently taking, I recommend consulting with our knowledgeable pharmacist, Robin. Robin can provide personal advice and help ensure you're using the most effective and safe options for your situation. Finally, I'd like to talk about managing back pain during a flare-up, as it may require a combination of strategies to provide relief to prevent farther discomfort. Here are some effective approaches to consider. Repositioning. It is essential to frequently change your position to alleviate pressure on your back. For example, if you're working on a task, alternate between standing or sitting positions, or take short walks around your space if that task allows. Regular repositioning can reduce strain or prevent stiffness. Secondly, this is a big one, stretches or relief positions. Engage in specific stretches or relief positions guided by a kinesiologist or occupational therapist. They can provide you with targeted relief. These professionals can recommend exercises tailored to your needs, helping to reduce tension and improve flexibility. Hot or cold compress. Using a hot or cold compress can offer short-term relief for back pain. Options include heating pads or magnetic bags for soothing heat, ice packs to reduce inflammation, and alternating between heat and cold may be particularly effective. Additionally, medications, as discussed in the previous slide, can be an important part of managing back pain, depending on the severity. One might consider over-the-counter pain relievers or prescribe pain medications by a medical professional. Consult with your healthcare provider to determine what the best option is for you. The fifth option would be topical ointments. Applying topical ointments could also help manage pain. Products such as Rub A535, Voltaren, or Deep Blue are ointments that can provide localized relief for ease and discomfort. And finally, consulting an allied health professional. Don't hesitate to consult with our allied healthcare professionals as needed. They can help you get out of a flare-up or put it under control and ensure you can continue with your regular maintenance strategies. This might include a physical therapist, chiropractor, or other specialists. In conclusion, by implementing these strategies, you can effectively manage your back pain during a flare-up and maintain your overall well-being. Remember, it's important to tailor these approaches to your specific needs and consult with healthcare professionals for personalized advice. In order to protect our backs going forward, it's important to find strategies for your own toolbox, strategies that work for you in your everyday life. Putting all these strategies together, we have learned by making an individualized self-management plan can keep us on the right track. Oftentimes, when we are in the mindset of a flare, we have a hard time identifying different ways of getting out of that flare due to the brain fog caused by the pain. This is very common. It is difficult to think about strategies we have tried in the past that have worked. So a self-management plan is a nice way to compact and keep track of all those ideas or strategies we have to help our pain. Our toolbox, it acts as our toolbox. So then when we do have a flare, we have strategies to help us overcome it. The goal of this low back pain program is to support you and establish your self-management plan and help you find the tools that work for your toolbox to protect your back and turn down the level of pain when you're experiencing it on a day-to-day basis. We want to help you find the best lifestyle strategies that support you in doing things you want to do, need to do, and have to do on a daily basis to maximize your quality of life. Through our Rural Wellington low back pain program, we offer one-to-one support for you to find strategies that help you manage your low back pain. Our team of kinesiologists, occupational therapists, and pharmacists, as well as manual therapists, are here to work with you individually to help you identify and trial strategies to help you find what strategies work for you in your lower back. Thank you for taking the time to listen to this presentation, and I hope you take some of these strategies and apply them in your everyday life. Thank you very much. Bye-bye.